Support for this program is provided by the Foundation for Excellence in Louisiana Public Broadcasting and from viewers like you.
Hello and welcome to this special edition of Louisiana Public Square. I'm Natasha Williams, anchor reporter for Louisiana, the state we're in. In just a matter of months, a microscopic virus has wreaked havoc around the globe and here in Louisiana. The outbreak has caused death and illness while leaving stress and uncertainty in its wake. Over the next hour, we hope to bring some clarity and calm to the discussion. We'll be joined by Governor John Bel Edwards, Senator Bill Cassidy, and Congressman Garrett Graves and others to answer questions about the epidemic in the state, assistance for those in need, and financial concerns moving forward. During tonight's program, we hope to encourage our viewers to join in an interactive survey. Text COVID to 225-263-4884 and share your thoughts throughout the broadcast. The panel for our segment tonight on Louisiana's medical status includes Governor John Bel Edwards. The governor will be present during all three segments of our show. Dr. Alex Billioux, Assistant Secretary of Public Health for Louisiana's Department of Health, as well as Sarah Berthelot, President of the Louisiana Association of United Ways, which also serves as the lead on the state's 211 COVID-19 response. Louisiana's 211 has already received 50,000 questions. Governor, I'd like to start with you. Where are we in terms of cases, deaths, and flattening the curve? And where are the new hotspots, if any, in the state?
Well, thank you, Natasha. First of all, we've added 331 cases today at our noon update. That brings us to 24,854 statewide since the beginning. And unfortunately, we added 77 deaths, and so we went over 1,405 deaths overall. If you look at the trajectory of new cases, as they've been coming online, and you know that as a state, we are certainly flattening the curve. And that's evident over the last 6 or 7 days, which is a good thing. What that means is the stay-at-home order is working, social distancing is working, people are complying with all of that and exercising proper hygiene. Now, we could always be better, and I'm encouraging people to do that. We haven't had really a new hotspot emerge over the last few days. I will tell you the last real hotspot we had was between New Orleans and Baton Rouge and the river parishes, and that seems to have flattened out now too. And I will say that the R0, which is the growth rate that you use in the modeling, all of it is trending at about the 1.3 level, which is about where we thought we would be, quite frankly, and doing relatively well. But we've got a ways to go to make sure that we stay on top of the virus, that we don't see cases start to spike again, and certainly we don't want to have more deaths than is absolutely necessary.
Well, this week you announced that the Department of Health issued a revised order for medical and surgical procedures. Bring us up to speed as to why elective procedures will be the first thing to reopen.
Well, first of all, we know that we got to get people back to seeing their doctors in order for them to be healthy, especially the people with the comorbidities that make them especially vulnerable to the virus. For example, we know 56% of the people who die from COVID-19 have hypertension. Another big percentage have kidney disease or heart disease or obesity, you name it. So we want these people to be as healthy as possible, so you've got to be able to reconnect them to their physicians, to their care. And that's a big part of this. It's also essential that we stand it back up because healthcare is a big part of our economy as well. But what we don't want to have happen is people who don't necessarily have an emergency condition, but if they go too long without care, it can become an emergency condition, and then they start going back into our hospitals at the time we need those beds available for COVID-19 patients. So we thought it was the right thing to do, but it has to be done in a very smart way. That's how the Department of Health has issued the order. Yeah, we're phasing it in, but we're making sure they're going to practice social distancing, that they're going to be temperature testing everybody coming into the clinics, that they're going to have adequate stockpiles of PPE, for example. All of these things are going to be very closely monitored, but we thought it was the right thing to do, especially given the health disparities we have in Louisiana that we're uncovering. partly because of COVID-19, we know that we have to get people as healthy as possible to withstand this disease should they contract it.
Okay, this question for you, Dr. Billioux. Where are we in terms of testing? And do we really have to have a vaccine really to allow people to go back to work?
Well, we're doing pretty well in testing compared to many states around the United States. We're seeing a lot of states now surge their capacity, and I think lots of people trying to certainly catch up. But we know early on we had one of the worst outbreaks in the nation. In the first 13 weeks or rather the first 13 days of COVID-19 outbreak here in Louisiana, we were having the fastest rate of growth in the country. And so because of that, we not only surged testing at our state lab facility, but also had partners coming out of the woodworks across our healthcare systems, really saying, how can we help with testing as well? And that's meant that we've had a lot more testing come online, a lot more coordinated testing. Here in Baton Rouge, we saw the major competing hospital systems come together to support a single drive-through testing site because they knew what was most important was that people get tested. And we've seen that in areas around the state. So that's put us in a pretty good spot. But as the governor and I have said previously, we need to do much more, especially as we start talking about this next phase of testing and contact tracing. It's really important that that first step is that we identify who has COVID-19 so we can get them the resources and identify the people who may have been exposed as quickly as possible.
Talk about the vaccine.
Certainly. So I think the discussion around vaccine is really a longer-term goal that we have, certainly as a country, as a state. We are going to have a certain level of protective immunity, meaning our immune systems are going to have to be able to fight off the virus because none of us have seen it before except for those people who've already had COVID-19. And so before we can start going back to life as it previously was, we need to be able to know that people are protected from the virus. And so there's a lot we're doing now to protect people from getting the virus. But in the long term, our goal is, and what we're all hoping for, is a vaccine that allows us to go back to visiting our loved ones in nursing homes, goes back to having hospitals operate normally, and has us going back to big events, funerals and weddings and the like.
But we can't wait for a vaccine to get the country opened up again.
That's right. The vaccine's probably around a year away, maybe a little bit longer. We have seen as a concerted international effort, really everybody just as focused on trying to get this done. So I think if anything, that puts us in a good position for having a vaccine as quickly as possible. But we also need to be realistic about what that means. And in the meantime, try to see how we can adapt the way that we live, the way that we interact with each other, so we can live through this virus until we have a vaccine for this virus.
Okay, thank you. Sarah, let's get into some of the not so common, before we actually get into some of those not so common questions that we've been fielding. There are some concerns that you're hearing right now. Let's hear about those.
Well, as you've said, Louisiana 211 has answered about 50,000 phone calls, and a majority of those phone calls are opportunities to give people facts about COVID-19 in an effort to stop the spread. About 12,000 of those calls were from callers expressing needs that they had as a result of the economic crisis that's taking place as a result of the pandemic emergency. Prior to COVID-19, about 48% of Louisiana households struggled to make ends meet, to afford the basics, and made hard choices every day. So the COVID-19 health emergency and economic crisis makes those choices cut even deeper. Top needs that are requested and through the 211 line include food access, shelter, medical care access, and then financial assistance to help with the household to maintain the home. And so this is aligned with what United Way and many of the nonprofits who provide services in communities throughout the state. We're working really hard to provide services and support to these families, in addition to ensuring that citizens know how to access public benefits that are available to them at this time. So it's of great concern. We have reason to believe that we need to be in a position to help families climb out of the economic crisis that they will find themselves in if they're not already there.
Some of the questions not getting answered?
Well, we are able, because 211 works year-round, to mine out information from local nonprofits and other service providers about available help in communities throughout the state, we are in a position to providing, not only can we provide COVID-19 information, but we can guide and make referrals to local sources of help for these families. So I'm very proud to be part of the nonprofit sector serving at this time. We have area VOADs and others that are just stepping up and doing everything they can to provide supports to families at this time.
Okay, thank you. Dr. Billioux, we know that poverty can play a significant role in underlying chronic conditions that leave people more susceptible to COVID-19. Can you touch on how the virus is disproportionately affecting African Americans and what they can do to protect themselves?
Yeah, well, as you said, I mean, anybody who finds themselves in poor economic conditions might have a difficult time accessing the necessary health care. But even after something like expanding Medicaid, we know that what you eat, what you have access to as far as employment, the level of stress that you experience every day can have significant impacts on your body and your risk of things like heart attack and cancer, but it also can have an impact on your immune system in the near term. And we know that there's a disproportionate level of stress and impact on our communities of color and especially our African American communities. So unfortunately, what we think we're seeing is higher rates of people becoming infected and then higher rates of death in the African American communities. And that's not where it stops. It really is where it starts for us. How do we identify what we can do now to try to reduce the risk of getting infected in those communities, the risk of death in those communities, and then in the long term, how do we try to continue the work that we've been doing to remove these disparities?
Okay. Governor, could you touch on the Health Equity Task Force and also touch on what's happening with Louisiana's prisoners?
Yeah. Well, the Health Equity Task Force is something we stood up, and because we want to make sure that we're doing everything we can to examine what makes certain parts of our population more vulnerable. Why is it that there's a prevalence of these comorbidities, and what can we do about it both in the short term and in the long term? In the short term, for example, we can better communicate with people, hey, you're more vulnerable to this virus because you have hypertension, because you're obese, because you have heart disease or kidney disease. And these are the things you can do about it right now. First of all, reduce your salt intake, make sure you reduce your sugar intake, exercise, take the medicine that you've been prescribed, get as healthy as you can right now. But going forward, we also have to make sure that we have more access to health care for individuals, not less access. And then nutrition is a big part of that. And it's also true that poor people may work in settings that make them especially vulnerable to contracting the virus in the first place. Or maybe they are more dependent upon mass transit where it can be communicated. And so all of these things will inform what we're doing. With respect to prisoners, I can tell you that from the very onset of this, in the middle of March, we stopped visitation. We took those prisoners who were most vulnerable because of their age or because of these chronic health conditions, and we reverse isolated them to try to prevent them from ever coming into contact with the virus to begin with. As people have shown symptoms, we've taken and we've isolated them as well. Unfortunately, today we have about 96 state inmates who are positive for COVID-19, 10 of whom are in the hospital. We've lost 2 who've actually died, both 69-year-old men with several comorbidities. And also, unfortunately, we've lost 3 Department of Corrections employees, including the warden at Avoyles and the medical director at Avoyles. So this is a disease that doesn't discriminate. It's a very tough disease, but I will tell you, we're doing what we can to protect our inmates and those in local jails as well.
Okay, Sarah, I understand that a couple of medical questions Louisiana residents have don't get a lot of attention. Could you talk to us about those? Share them with us.
Sure, and I know Dr. Billioux is going to help me out. He's the expert, so he's going to give the answers. But we have about 150 questions that we receive on a regular basis through 211. Some that are not common include, if I'm HIV positive or have a condition like HIV positive, am I more likely to contract COVID-19? Or what if I'm pregnant? Does that make me more at risk?
Yeah, and so, the point that the governor just made about hypertension, diabetes, taking your medicines, taking care of your health, fortunately, HIV is treatable. It's certainly the primary impact of that virus is to reduce your immune system. And so left untreated, somebody would be at higher risk for an infection. But for the last 25 years or so, we've had, and even especially the last 15 of those, had really great medications that when taken steadily can restore the immune system, keep the immune system intact, and shouldn't put somebody at a higher risk. Now, that doesn't mean that they're immune from COVID-19. They still need to take all the previous precautions. And with pregnancy, it's a similar situation. The challenge for a pregnant woman is that she has to interact with the medical system a little bit more than we're recommending most people do these days. So definitely taking steps to make sure that we're protecting people coming to our clinics is key. And then for them, make sure you're clean up around the house. We don't think that there's any particular risk posed to pregnant women or to their babies either by COVID-19 at this time.
Okay, that's good news. How about another question, Sarah?
Well, a question that's becoming more common now is, I work at an essential business. I may have been exposed to COVID-19. Should I report to work, and what precautions should I take? So,
yeah, and this is a really important one, especially going forward. When we start talking about more people, working, we need to be taking precautions. Our essential workers across the board are really heroes right now, showing up despite the concerns that we all have about COVID. Our healthcare workers, our first responders, still in the line of duty, and that means to some extent in the line of fire for being exposed to COVID. So that's why we've prioritized getting personal protective equipment to those providers to reduce the risk that if they're with somebody who has COVID, that they themselves are at risk. But the fundamental answer is we need them to continue to come to work, and until they develop symptoms, until we have concerns that they have COVID, they should continue to work. If they develop symptoms, we want to prioritize getting them tested.
Okay. Sarah, besides dialing 211, what else can people with questions about COVID-19, how can they reach out to your organization, and who are you partnering with to make sure that your information is accurate and up to date?
Well, they can dial 211 24/7, all languages. We can help them. They could also visit our website, where all the frequently asked questions is available at all times at LA211help.org. It has all of the FAQs. And they can also text us at LA COVID at 898-211. And if they want to talk to a live specialist via text and interact via text, all they have to do is text their zip code to us at 898-211, and we'll talk to you via text. And so I have to say, we have a lot of partners out there that help us to ensure we have correct information for COVID-19 questions. We work closely with Dr. Billioux and his team at LDH. When we see a new question come through our lines, we escalate it up and we work together to curate the facts with the CDC requirements and any other guidance his team has so that it's available. But also, we work every day in every city of the state to collect information about what's available for people in local communities. So those two together equip 211 well to serve any call that comes through. If we have the answer or if something's available to you, we're going to be able to give it to you on the 211 line.
Governor, last week the state legislature deferred voting on a bill to postpone the presidential primary and extend voting by mail. What is your response to the delay?
Well, first of all, I think they're going to receive tomorrow, the House and Senate Governmental Affairs Committee will receive a revised plan from the Secretary of State. It's my hope and expectation that they will approve that plan and that we will be able to move forward, moving from 7 days of early voting to 13 days, so we can extend that out and have fewer people trying to vote at any given time. The election day will be carried out largely as it always is. We'll have to find some new polling places for those precincts that are located in nursing homes, for example. We don't want to be doing that, but that'll take care of itself. And then there will be an expanded list of reasons for which you can request a mail ballot. But we believe that this has been coordinated now with the leadership in the legislature. We've got it in a form that should secure their passage tomorrow in the committee, and then it goes out to all the members of the legislature to actually vote on by mail. And if a majority of the House and a majority of the Senate vote to do that, I think we're going to be able to go forward in a way that's responsible, and we should be in a position to allow people to vote in July and August in the primary and the general election respectively, in a way that allows them to cast a vote without jeopardizing their health. And that's what we've been looking for a solution for. So I appreciate the work of the Secretary of State, Kyle Ordwin, and his work with the legislature to try to make that happen.
Okay. Thank you, Governor. Well, thank you, Governor. Thank you, Dr. Billioux and Ms. Berthelot, for that information. While stay-at-home orders have been protecting our physical health, they've also put our financial health and of Louisiana residents at risk. When we return, we'll explore the state and federal programs to assist those in need, and when we will begin to see an opening of our businesses and the economy. Stay with us. Welcome back. Tonight, we're taking the pulse of the pandemic and its impact on our state. Since the coronavirus outbreak, Louisiana's unemployment claims have increased from an average of 300 a day to about 10,000. Small businesses account for about 99% of the employers in the state, but their federal relief program has already reached capacity. On a positive note, last week, President Donald Trump announced guidelines for governors on reopening their economies. Joining Governor Edwards to help update us on all this information is U.S. Representative Garrett Graves. He represents Louisiana's 6th Congressional District. We are also joined by Kimberly Robinson, the Secretary of Louisiana's Department of Revenue. Governor, before we get into questions about reopening the economy, what do we know about the number of unemployment claims filed in the state and the status of the money that's being delivered?
Yeah. Well, right now, I can tell you there are about 300,000 claims that have been filed. It's a volume that we've never seen in Louisiana before, which is why I'm encouraging people to try to do it online between 10 p.m. and 5 a.m. at louisianaworks.net. And the vast majority of the funding paid out to date has been provided by virtue of the CARES Act. And I want to thank Congressman Graves and our congressional delegation for making sure that happened. So for example, we've got $540 million in unemployment compensation benefits that have been paid out. The vast majority of that federal money, but there's been about $60 to $70 million from the state as well that's been paid out to these claimants. But the $600 a week in the pandemic unemployment compensation, there's also $107 a week for the pandemic unemployment assistance, and then the state benefit caps out at $247 a week. Those are big numbers. And it's important because these people are without a job through no fault of their own. But these are really, really big numbers, and that's a lot of claims out there, which is one of the reasons why we're going to move forward as quickly as we can while protecting public health to get people back to work.
Congressman Graves, what is the status of the stimulus checks, and where is Congress in passing legislation to provide more funding for the Paycheck Protection Program?
Sure. Well, the stimulus checks, of course, are the individual checks up to $1,200 per adult and $500 per dependent child. Tens of millions of checks went out last week alone, primarily electronically. There is a limitation on the number of checks that can be printed and mailed weekly, so the federal government is encouraging as many people as possible to submit electronic information. The electronic payments are expected to be made over the next few weeks. The printed checks, unfortunately, are going to be taking the next few months. In regard to the Paycheck Protection Program, very popular program. So far, over $5.1 billion in loans approved for small businesses in Louisiana, nearly 27,000 small businesses, but the program is so popular it did run out of money. We'll be voting this week to replenish about $310 million into the program to allow it to continue moving forward in addition to other assistance programs.
Okay. Secretary Robinson, before we get into your work with the Resilient Louisiana Commission, are there any tax news information, or is there any tax news information that you want to share with businesses and individuals about relating to this pandemic?
So I want to follow up on what the Congressman just said. For those individuals that are expecting their $1,200 stimulus check, we got information from the IRS this week. For those who receive veterans benefits and Social Security benefits, we've gotten a lot of questions about how they go to either file a tax return. Most of them don't file tax returns. Those benefits aren't taxable. They don't have to take any action. We got that message from the IRS this week. They've worked out a plan with the Veterans Affairs Department and with Social Security. They simply need to wait. They're going to actually get their $1,200 stimulus in the same way that they get their veterans benefits or their Social Security benefit. The only way they need to take action is if they have that dependent child for the $500. They would go to the IRS website and fill out that information for that dependent child, and that would be added to their $1,200. But for everyone else, don't worry about taking any action. For those veterans that are receiving benefits, the SSI benefits, or regular Social Security or railroad benefits, no action is needed. Those $1,200 stimulus payments will be coming out electronically. Unfortunately, some not until May, but they will be coming out electronically in the same way that they currently receive their benefits to those accounts. So no action is necessary. And the most important thing is don't take any calls or provide any information to anyone calling in and ask you for information to get your stimulus payment. The IRS will never call you and ask for information. That is not how they operate. So do not let anyone call you. That will be a fraudulent call. So just wait for your payment.
Okay, Governor, while the federal loan program for small businesses has reached its capacity, can you tell us about the status of the Louisiana Loan Portfolio Guarantee Program?
Yeah, which is a good program, but obviously it's taken a back seat to the federal program because that loan is actually forgivable if people will use it for certain purposes, if businesses will use it for certain purposes. And as the Congressman mentioned, over $5 billion already claimed by Louisianan businesses with respect to that. So we've got a program at the state level where the state put up $10 million. It's a $50 million program overall where we underwrite 20% of the risk. And that's to induce banks to give loans to small businesses that bear no interest for the first 90 days, no payments required over those first 90 days, and the interest rate thereafter is actually a little lower than it is from the Small Business Administration. But I will tell you, the businesses aren't focused on our plan yet. They're going after the Paycheck Protection Program, which is what they should do. We will have numbers pretty soon on the utilization of this product that we have. We do have a number of banks across the state of Louisiana that have signed up to make these loans. We believe it's going to be a popular program, but it just isn't yet, and it won't be until probably this next allotment that comes out of the most recent legislation being taken up by Congress actually runs out.
And that's because basically part of that, if you use it for payments to employees, is forgiven. So it's a loan, but it's forgivable.
That's correct. So you can, as long as you use up to 75% or 75% or more of your loan under the Paycheck Protection Program to actually pay your employees, and you use the remaining 25% or less for rent, for mortgage, interest, or utilities, then your entire loan can be forgiven. And of course, there are other products in addition to the state products out there to offer a lending hand and a little bit of capital access to businesses to help them get through this crisis in Louisiana.
Congressman, there's some other funds coming from the state through the CARES Act, but is there any mortgage assistance or relief for landlords who right now they can't evict people who aren't paying?
Yeah, it's a great question. You can't just come provide relief to the tenants and not provide relief to landlords. Otherwise, it's a cascade effect. And so what happened is back on March 23rd, the Federal Housing Finance Agency actually granted forbearance or some relief to those building owners who have multiple tenants and allowed them some more flexibility so that way that additional flexibility could be granted to the actual tenants of buildings. And so this has happened in commercial lending, it has happened in residential lending, and so there's all sorts of relief and assistance that's out there, and I'd urge anyone who is having trouble making ends meet to reach out to their lender and ask for assistance, because much assistance has been granted at the federal level that allows those lenders more flexibility.
Okay, Secretary Robinson, tell us about the Resilient Louisiana Commission and its role it will play in the reopening of Louisiana's economy.
So the Resilient Louisiana Commission was announced by the governor on last week, and it is a 15-member commission that has 15 industry task force sitting under it. This commission will provide guidance to the governor and the administration on what are the best things for those industry sectors as we move forward with reopening. As the governor was just talking about in the last segment, reopening the economy is very important. Doing so in a safe manner in accordance with meeting those health guidelines that Dr. Billioux was speaking of is also very important. But what is it that those industry sectors need as they move forward? How do they do so in a safe manner? What's important for their employees? And what have they seen from a specific industry as they have gone through the stay-at-home order? Some of the essential businesses have been open, and so they've had some experiences with their employees coming to work. What have they done from a social distancing perspective? What have they done to make sure that their employees have the proper PPE? How have they gotten that PPE for their employees? What do they want to see going forward? For those businesses that have been closed, what do they need in terms of support to reopen? What do they need to know? Do they need to do temperature checks for customers coming in? Do they need to provide PPE for workers coming back? Should they be concerned about customers that are coming in that may, for one, be concerned that do the employees have everything that they need before I come in to get service? All of those are things that those industry experts will be able to provide us as we look at opening the state back up. And so we are looking at industry experts in energy, communications, information technology, real estate, all across the spectrum to tell us what do we need to do. Restaurants, because restaurants have been open, but they've been providing curbside or delivery. But if we go back into restaurants, what needs to be considered? Can we go back in and have tables that are side by side? Do we need to be more spread out? Entertainment venues. Everyone has been very interested. Can we go back to movie theaters? College football. I know I'm looking at two college football fans on the other side of me. Those are big questions. So we have all of those experts coming in to advise us in those task force and then reporting up to the commission. And we also have, most importantly, the healthcare sector involved. How do we make sure that our healthcare sector can survive if, in fact, we see an increase in cases coming back? What do we expect from the fall? Everyone has said this may come back in the fall. Are we prepared? Can we be resilient? Which is why this is called the Economic Resilience Commission.
Governor, briefly, let's touch on the reopening phases suggested by the president at this point. What is the plan for reopening Louisiana's economy, and how will we go about that in a safe manner?
Well, we plan to implement the guidance that he and the vice president and the coronavirus task force operating out of the White House gave us. I think it was last Thursday. There's some threshold criteria that need to be met, I should say, before you can get to phase one, and that they're basically measured over 14 days. Mm-hmm. And you want to see a downward trajectory of all the influenza-like illness being reported in Louisiana, the actual cases of COVID that you're getting, and then make sure that you don't have diminished hospital capacity. Then you get to phase one, and it's a gradual reopening where you do what you can while maintaining social distancing, making sure employers, where necessary, or have their employees with a mask on if they're going to be serving the public, those sorts of things. And then you progress. Every time you meet a new gate, you get to the next phase. But this is going to be a gradual reopening of the economy. It's incredibly important that we get started as soon as we can, but you got to do so when it's safe to do so, which is why they've given us these criteria. But Natasha, what I want everybody to understand, it's not going to be like flipping a switch, where if the current stay-home order expires April the 30th, and we go to phase one on May the 1st, and that decision has not yet been made because we don't yet meet the 14-day threshold test. But if we do that, we're not going back to life as we knew it 2 months ago. That's not going to happen. This is going to be a gradual opening of the economy, and it's going to be done so in a way that is smart and with a lot of testing and contact tracing capacity, so that if we see cases spike, we know how to keep those cases down, because we don't want to have to go back. We always want to be able to go forward with the reopening over time.
Let's talk about this antibody testing, why it's so important.
Well, it's really important, just like diagnostic testing for presence of COVID-19, because if someone has developed the antibodies to the disease, the assumption is, and by the way, it's still an assumption, is that they won't get it again. Mm-hmm. And then those individuals can resume activities just about back to normal. So they can go to work, they can get out in public and so forth. Now, we don't know for a fact that they can't get it again, or we don't know for a fact that the virus doesn't come back this fall or next spring mutated enough to where the current antibodies will be enough to fight it off. So there's a lot that we have to know, but these serology tests are very important. They also can be very inaccurate too, so we have to be very careful and only use those tests that are approved by the FDA. But those tests are starting to show up in Louisiana in big numbers. Oxnard, for example, already has 20,000 of those tests, and we'll get another 20,000 before the end of the month. So this is a big part of our overall testing strategy going forward to make sure that we can reopen safely.
Congressman Graves, can you touch on the importance of FEMA's emergency food distribution legislation that you're involved with? So many people are struggling. People have gone to food banks that have never gone to a food bank in their life.
They have. And so one of the things that I think is really important is, instead of going out and trying to reinvent the wheel each time something happens, looking at the existing entities that are out there that are doing that type of work and figure out how to enhance or how to expand upon the work that they're doing. Food banks is a perfect example. We saw in the big flood in 2016 that the food banks were able to distribute thousands and thousands of meals meals. We changed the law in 2018, and it is now being implemented for the coronavirus epidemic, whereby the food banks are federally funded now, working together with the state to help to complement the other assistance programs to make sure that families have the nutrition available to ensure that they can make it through this crisis. And so it's building upon those existing capacities and much more efficient than we've seen in previous disasters.
So there is some concern early on about the additional $600 that people were receiving as a part of their benefits. It would just de-incentivize them to go back to work, you know. So what has been done to kind of make that not an issue?
Well, it is important because once you get a Paycheck Protection Program loan, you have 8 weeks to spend 3/4 of that money on payroll. If you don't, you can't have your entire loan forgiven. So that clock starts ticking as soon as you get your money. So if your employees don't come back because they stay on unemployment, that creates a real quandary. There is a program under the Louisiana Workforce Commission called Form 77. It's a document that the employer can submit indicating that they have offered the job back to the previous employee. That employee is no longer eligible for unemployment assistance at that point. So there is sort of an enforcement mechanism in place. But of course, all of us just want folks to do the right thing. And I know that people in Louisiana want to work. And so we're continuing to encourage those folks to get back to work as quickly as possible and get our economy.
If you don't go back to work, do you still get that $600?
You have to self-certify each week indicating that you do not have a job or a job offer. If those folks do that and say that they haven't been offered a job while they have that, it would be fraudulent or illegal, and they would be subject to having to pay those that unemployment assistance back.
Okay. Governor, some closing comments about this particular issue that we're dealing with as we try to reopen. What do we say to folks who are protesting, saying, open up now, you know, this is the time, we want to go back to our lives?
Look, I get their frustration. I want them back at work. I want our businesses open too, but we also have to balance the public health. And by the way, we always say public safety, public health comes first. Well, it really does. And so we have to listen to the experts. And look, there are always going to be people who have different opinions about things. And what's great about living in the United States of America and here in Louisiana, you can express those views. And so that's fine with me. But at the end of the day, I don't need anybody telling me that folks want to get back to work and folks want businesses open. We know that. And to the extent that there is a political connection to the protests, I want them to understand that I am implementing the plan that was given to us, the guidance that was given to us by the president and the vice president, informed by the CDC, informed by Dr. Birx, informed by Dr. Fauci, so that we can move forward as best we can in a responsible way. But this idea that somehow what I'm doing is unconstitutional, you know, I absolutely say that is not the case. But I, like them, am looking forward to the day. Don't know how quickly we can get there, the day that life is back to normal. That doesn't happen until there's a vaccine. But between now and then, as we are able, we're going to transition to opening our economy back up, getting our businesses back open, and getting people back to work.
Okay. Thank you. Well, thank you, Governor, Secretary Robinson, and Congressman Grace for all those details. As we cautiously move forward with restarting our economy, do we know how much damage has been done and what recovery may look like? We'll look for answers when we return. We're back and we're taking the pulse of COVID-19, the pandemic. The estimated federal response so far will add $1.6 trillion to the deficit over the next decade. As of mid-April, Louisiana itself has spent more than $587 million on the coronavirus measures. And the Federal Reserve says America's industrial output has fallen to levels never seen since 1946. Joining the governor to explore the health of the economy now and moving forward is U.S. Senator Bill Cassidy. The senator is selected last week for a task force providing input to President Trump on reopening the country. We're joined also remotely by Dr. Lauren Scott, Professor Emeritus of Economics from LSU. Governor, let's briefly start with you. Could you tell us currently how much has the state spent on the coronavirus response and how much is being covered by the federal government?
Well, we're just shy of $600 million. And until we get to $662 million, the federal share under the Stafford Act is 75%. we're going to get to $662 million. At that time, the federal share will go to 90% as provided under the Stafford Act. And I know that there are a lot of states that are asking through the National Governors Association that the federal government go ahead and see if they can pick up 100%. But whether it's 75, 90%, or 100%, the federal government is picking up the biggest part of the cost of our response. And we really appreciate them doing that. And I want to take just a moment to thank Senator Cassidy, who's working so hard on today with, I don't know if you're calling it CARES 3.5 or what, the instrument that actually passed the United States Senate today by unanimous consent. All of that's very, very helpful to the state of Louisiana, and the partnership that we've had working with FEMA, working with the Vice President and the task force that he leads out of the White House on the coronavirus response, and with the President himself. The working relationship has been really good, and I especially appreciate Senator Cassidy because he's been to GOSEP. We've had discussions, and he's letting me know what they're working on in the Senate, some things he thinks that I should be considering here at the state level as well, and I appreciate it.
Well, Senator Cassidy, you just announced a proposal this week called the SMART Fund to further help state and local governments with recovery. Can you explain that legislation?
Our whole goal with all the CARES Act 3.0, 3.5, how do we help individuals, families, and small businesses, employers, if you will, get through this rough patch? And so we do it with a check. My daughter got a $1,200 check today. She lets me know that. Employers are getting their payroll protection. But imagine, if folks get through their bills, employers get through the rough patch, but then we don't have the police, the fire department. My gosh, don't we appreciate the sanitation workers? State and local government has taken an incredible hit on their income. If hotel tax and sales tax is how you keep your boat afloat, do you keep your police officers employed? You're not going to have it. If we're going to help those individuals, families, and small businesses do well on the backside of this, then we need to have cities help their first responders be on the streets, not a city on its back bankrupt. The bill I proposed, bipartisan with Senator Menendez from New Jersey, would give some cash to these municipalities and state governments to make up for that lost tax revenue to preserve that capital, that human capital infrastructure.
Dr. Scott, when you look at Louisiana's economy, what sectors are being hit the hardest, do you say, and how do we see our recovery compared to the rest of the country when it comes down to it?
Well, it probably will not surprise people to learn that the hardest hit sector is the restaurant and accommodations area. If you look at the unemployment insurance applications for the last 4 weeks, which have just been unbelievably horrendous, like nothing we've ever seen before, about a quarter of them, those applications came from the restaurant and the accommodations area. And then, of course, the second area, which was made up about 12%, came from the retail trade. If you go around, notice that there's a lot of people that are not working. Our grocery stores are working, but Macy's, Dillard's, and many of your local retail stores are not working. The third area is one that I was surprised at. I thought this one was going to actually add jobs, but the healthcare sector, there's a lot of doctor's offices that are closed. There are a lot of electric surgeries that are not taking place. So about 12% of the unemployment claims actually came out of the healthcare sector. And then the final area is the construction sector. Many of our projects have been delayed. Some of you that live in the Baton Rouge area know the Methanex project. Methanex 3, which is about a $1.4 billion project, has been delayed for a while. And you're seeing layoffs among kind of our key employers like Turner Industries, Performance Contractors, and Cajun Industries. I've done a rough estimate of the number of jobs I think we'll ultimately lose when the numbers come out for April, the first full month of this. And my rough estimate is around almost 350,000 jobs. That our unemployment rate will probably be close to 22% when those numbers come out in late May. So this is something that I've been professional economist for 40 years. I've never seen anything like this. Really something. But the good news is the underlying basis of the economy is in fairly good shape, except for one, and that is one very important to Louisiana, and that's the oil and gas industry. Oil prices are very low right now, and unfortunately, a lot of oil is being pumped right now. I was hoping it would be cut off in the middle part of April. It was not. It's still flowing out there. It is filling up tanks. It's filling up tankers. It's filling up pipelines. And unfortunately, that's going to keep the price of oil low for quite a while now, I think. which means that we're not going to come out of this as well as, say, Iowa or New York or South Carolina, someplace that doesn't have a big oil and gas industry base. It'll be a little bit tougher for us.
Let's talk about the northern part of the state, which is not so oil reliant.
Yeah, well, part of it is actually the Shreveport area has quite a few actually operating wells up there, and a lot of people involved in the oil and gas industry. That's actually where drilling started. It won't be quite as bad for them, certainly not as bad as for Lafayette and Houma. Monroe, on the other hand, and Alexandria do not have very much in the way of oil and gas extraction going on, so they will not get hit as badly. Neither will Hammond, for that matter, will not get hit as badly. The real hits are going to come, especially in Houma, which has the highest percentage of oil and gas employment in the state, and then Lafayette. Those are the two sectors that are going to be really hard coming back, which is terrible because they've just been trying to get out of a recession that started back at the end of 2014.
So are any positive news as far as like sales tax, grocery stores, things like that? Are we getting something positive out of that?
We're getting something. Unfortunately for the governor, the sectors that are really enjoying extra sales because of people's hoarding is not subject to the sales tax. Your grocery stores, your pharmaceuticals are not taxed at the state level. So that's a bit of a problem. As a matter of fact, we were talking before we started filming with the governor. He and the legislature have a tough row to hoe going into this legislative session. I think they're going to have to deal with a pretty significant shortfall from this fiscal year, and then if that price of oil stays low and we're slow to come out of this, he's going to have he and the legislature have a really difficult problem in FY21.
Senator Cassidy, what advice have you been giving the president as far as reopening our country's economy?
So, Lawrence gave us statistics on unemployment. I had a town hall meeting. A woman called in, single mom, 2 or 3 kids at home, works at Taco Bell. How do I earn a living? How do I keep my children safe? When I speak to the president, I speak of that balance between physical health, financial health. If you really emphasize one, the other's not doing so well. We're really emphasizing physical health. We've got to for the moment. If we don't restore balance, people's financial health fails. At that point, their physical health suffers too. What do you do about that? I'm now going to speak as a physician, less so than a senator. You look on the LDH map, hats off to the governor and his team, on the Louisiana Department of Health website. You click over a few places, and there is a map of Louisiana broken down on census tract. You have within each census tract the number of cases of COVID-19 within that census tract. You could also overlay and have an overlay of where we have obesity, diabetes, hypertension. You go into that census tract with a trusted figure, a pastor, a mayor, somebody, you swab everybody. You find out who is infected, who is not. At some point, we may also know who is immune and who is not. And if they're infected, you ask them to quarantine. If they need assistance doing so, you give that assistance. And then you tell those who are at risk, who are not infected, be careful. But when you quarantine those at risk, you stop the spread, you dramatically decrease the death rate, and the faster you decrease that death rate, the faster you open up that economy.
So you're basically talking about your immunity registry.
Well, you can't have an immunity registry. It really does help if you know who's at risk and who's not. If you go to an employer and the employer knows that this person is at risk, so therefore there's 6 feet between them and their coworkers, and this person is not at risk, so they can be at the front desk shaking hands with people when they walk in. They don't have to fear being infected or infecting others. That's best of all. That's what we already do with chickenpox, measles, hepatitis B. We should extend that to this communicable disease as we do it with other communicable diseases.
Let's talk about your herd immunity.
Yes.
What is herd immunity?
Herd immunity is when you have enough people who are immune, and right now the best science, we think, is that once you've been exposed and cleared the virus, you are immune. Once you are immune, and there's enough people immune, they kind of protect everybody else because the infection can't get through them. It slows the transmission. But there's other reasons why to know someone is immune. I spoke to the CEO of a vaccine company coming out with one. He said there's 310 million Americans that will want to vaccinate. If we know that 80 million are already protected, we'll focus our efforts on the others. It would also be, as I mentioned, to your employer. If your employer knows that you are at risk, they take more protections, giving you PPE, but if you're not at risk, you can do something different. And it's also for your family. If the college student knows that she is immune, she can kiss her grandmother and kiss her grandfather and not worry about transmitting infection to someone at high risk of death. If she does not know that she's immune, she is not going to embrace or enjoy that experience of family so fully because of that. There are so many advantages of knowing who is immune and who is not immune.
Governor, you said it when we talk about May 1st as a date, a target date to open. It will not be like flipping a light switch. We heard Dr. Fauci say that as well. What do you say to people who can't understand, what's going on here and just keep pushing to open right now?
Well, this is what I'm very certain of. It was just a month ago that we had the fastest growth in cases in the world. Had that continued unabated, our economy was going to absolutely crash. We would not have been able to deliver health care. Our ICU beds would have filled up, and we would not have had ventilators and so forth. And so we need to make sure that we don't get ourselves into trouble going forward either. And that means you have to have a rational approach. And we're doing this in complete conformity with the CDC guidance that we received from the president, the vice president, and their task force, talking with the State Department of Health, and talking to employers, some of whom have already been open because they were essential, and what did they do to protect their workforce, and then what lessons can we learn, and then provide those lessons to the other employers who are going to be coming back online. So people should not expect, if we're able to transition to phase 1 by May the 1st, and I'm not making that announcement today because we haven't met the threshold criteria, I hope we will. I believe we will. And if we make that transition, it will not look like it did before COVID-19. And I will tell you, Dr. Scott is exactly right, and he paints a pretty bleak picture, which is why the work that Senator Cassidy is doing to try to make sure that state and local governments have some revenue coming in, by the way, with flexibility attached to it so that it can make up for lost revenue. I believe the CARES Act 3.5, which they passed today in the Senate, will retroactively provide more flexibility for the $1.8 billion that the state already received, but we still have to figure that out because we are not going to have the revenue going forward to maintain. And you're talking about appreciation for people. I promise you, parents across the state of Louisiana have a tremendous appreciation for school teachers right now. We have to make sure that we can pay our school teachers, for example, and keep them employed and keep our schools open going forward. So this is a very challenging public health emergency that spills over into every aspect of life and every aspect of government. It is very difficult to manage, but we're doing the very best we can. And I have supreme confidence in the people of Louisiana, in our businesses, and in our workers that we are going to be able to rebound from this. But it's going to take a while, and unfortunately it's going to be painful between now and then.
Dr. Scott, can you briefly tell us about the stock market, what it tells us about the economic health of the nation overall? Well,
it certainly tells us a lot going down, okay, because investors are looking at the potential profits in firms and when it comes to making investments. And in an environment like we're in right now, there is so much uncertainty that what you do is you scramble out, you get into something else. A lot of times what you do is you get into gold, as it turns out, which drives that price up. When the stock market is going up, most of the time that's an indication that the economy is doing better. But one of the things that's going on now, in order to help the economy out, the Federal Reserve has driven interest rates down to almost zero. When interest rates are almost zero, investors are looking for some place to put their money. And so even before the coronavirus hit, I think the stock market was probably way overvalued. And the reason for that was there's no other place to put the money besides the stock market. You couldn't make any money in CDs, couldn't make any money buying government bonds or bills or that sort of thing. So you went to the stock market direction. So it kind of depends. Usually on the downside, it's a pretty good indicator that things are bad. On the upside, it's a good indicator, but sometimes it overstates how good things are. Let me mention one other thing here. You were asking about any pieces of good news. And one of the pieces of good news in Louisiana is that we have the second highest concentration of chemical industry employment in the United States, second only to Texas. And the good news about those firms is those firms are 24 hours a day, 365 days a year. They are constantly operating. And number two, they are very high wage industries. And for the most part, I think with the exception of one firm, the Bayer firm down there in New Orleans, all of these chemical firms are still up. They're still operating. They're still employing people. They're still paying those very high wage rates. A lot of states don't have that, and that's a good solid base for us here in Louisiana that's helped us out.
Thank you, sir. Governor, briefly, how optimistic are you that the Louisiana's economy can rebound?
Oh, it will. I have no doubt. It's going to take a while, and as I mentioned just before you went to Dr. Scott, it's going to be painful for businesses. It's going to be painful for employers. We're going to try to minimize that pain while we protect public health and transition back. But quite frankly, until we have that vaccine that confers immunity upon people, it's going to be really hard to see us ever reopening fully. And up to the capacity that we have at our various restaurants and so forth. And how we're going to get tourists back to Louisiana. You know, what is it that's going to give them the confidence to travel so that they know if they come here, they're coming to a place that's really safe. And that's another reason why you have to protect public health, because if you don't, you know the tourists aren't going to come back in the numbers that we need them to be helpful. Obviously, we need the price of oil to rebound considerably. It was already lower than we wanted it to be by about 2/3. And then over the last couple of days, we've seen what happened. So hopefully we can get the supply and demand issues figured out across the globe. We know that as the economies open back up, there will be more demand for oil and for gasoline. But how long does it take? And I think this was Dr. Scott's position. We have so much excess capacity because it's being pumped and they're using it, they're filling up pipelines and they're filling up vessels. And so that demand actually has to get to those sources of oil before we actually have to get back to more production. And so it's actually going to delay the amount of time or delay, I should say, the recovery in that sector. But we're going to get back. I am fully confident. We have some of the most innovative people anywhere in the world right here in Louisiana with our businesses, our employers, and I know we have employees who want to get back to work, and we're going to make that happen.
Well, thank you so much.
Thank you.
Well, unfortunately, we've run out of time. I want to thank the governor, Senator Cassidy, Dr. Scott, and all of the panelists who participated tonight. Remember, you can still provide interactive feedback on our program. Text COVID to 225-263-4884 and share your thoughts. And for all those parents watching, just a reminder that LPB is broadcasting educational programs on its main channel each day from 5 a.m. to 5 p.m. You can also access online educational resources at lpb.org/at-home. Thanks, everyone, and have a good night.
For a copy of this program, call 1-800-973-7246 or go online to www.lpb.org.